Hi, I'm Dr. Heather Hirsch, and welcome back to my YouTube channel, the best place for all things menopause, perimenopause, and hormone replacement therapy. If you don't know me, I'm Dr. Heather Hirsch. Way more about me at the end. I want to get right into today's video. Today, I want to talk with you about how you can set yourself up for success, how to have a great visit with your own doctor to discuss the use of hormone replacement therapy. Now, there's been so much on social media. There's been so much in terms of celebrities talking about menopause, public figures, so much in the news about menopause and the safety of hormone replacement therapy that you'd probably be living under a rock if you haven't seen the pendulum swinging in terms of more favorable emphasis being placed on women discussing hormone replacement therapy. So if you have a doctor who you're not sure how this is going to go, I'm going to give you the best tips and tricks for you to get the most out of your doctor's visit. Let's do it. The very first thing that you want to do is you want to call your doctor's office and you want to say, I would like to set up a problem-focused visit to discuss perimenopause or menopause or whatever it might be. The reason that this is really, really important is, trust me, this is a lengthy conversation. At the collaborative where I see patients, we have an hour for our first visit with our patients. And in my academic career, I used to spend at least 45 minutes with patients discussing, is it appropriate for them to take HRT? Is it safe for them? What type, what kind, what route, what dose? All of these things. And so you're going to want to set up a problem-focused visit with your clinician. The time to do this is not during your annual exam. And I know that that's really frustrating, especially if your insurance doesn't cover, more than your annual exam, but your clinician is walking into that annual exam with a list of things that he or she needs to get done, which includes your immunizations and updating your medical chart, your family history, refilling any medications, making sure you're getting your screening tests for things like colon cancer and breast cancer and etc. And then to add something on top of that, it actually means you've got like 2 minutes to talk about it. So the very first thing that you want to do to take control of your health is to call your doctor's office, if that's where you want to start, and say, I would like to set up a problem-focused visit to discuss fill in the blank, perimenopause or menopause. All right, on to number 2. The second thing that you want to do is you want to go into that visit armed. You want as much information as possible. So what I want you to do is journal and track. I want you to come in with a piece of paper. I want you to, before that, think about what symptoms are most bothersome to you. When are they most bothersome to you? What have you tried that probably hasn't worked, because that's why you're going to see the doctor. And that is going to be so vitally important. You are going to take the guesswork from that visit, which could take 15 or 20 minutes of that visit, and you are going to come in and you're going to give it to him or her in the first 60 to 90 seconds. It could look something like this. Hey doc, I've been having night sweats, hot flashes, and brain fog for the last 6 months. I also want you to say, again, what have you tried? I have tried black cohosh over the counter. I have tried calming music to go back to sleep when I wake up, and nothing has helped. Then, as a bonus, I want you to say how it has affected your quality of life. And don't be shy. I want you to say, this has significantly impacted my work. I am thinking about either quitting or retiring, or I think my job is on the line because my symptoms are severely affecting my quality of life. Say it with me. My symptoms are severely affecting my quality of life. This is really going to get your doctors to perk up. And by having all of this already out there, that whole back and forth of, well, how long and what and this and what have you tried? You're just going to give it to them in the first 60 to 90 seconds, and you still got the rest of your visit to talk about hormone therapy. The third thing I want you to do is know your history. So whether that's your family history, medical history, your gynecologic history, and obstetrical history. They might ask you questions about these things when they're talking about if hormone therapy is right for you. And the more you know, the faster you can get through this part. If it's a doc you've been with for a really long time, they probably know. If it's a new doctor to you, or perhaps it's, you want to talk about your GYN or your obstetrical history with your primary care or your family doctor, knowing that is going to be really, really important. And here is the kicker. I'm going to say this once, and I'm going to say it loud and clear. There is no family history that precludes a woman from taking hormone replacement therapy. No family history under the sun. It may give your doctor something to think about. Family history is often used as clues to what you may be at increased risk for in the future. But if you are a healthy woman at the time, there is no family history that precludes you from hormone replacement therapy. This is a good time to remind you that I actually have a full course on this topic called the Reclaiming Menopause Masterclass. It is like a 6 to 8 hour in-depth version of this video, but supercharged. It comes with worksheets and it comes with scripts for you. And so if you're interested in the Reclaiming Menopause Masterclass, also for perimenopause, check that out in the links below. And I also have a course for clinicians. So this course, I now have 1,000 students in. This has really helped clinicians understand the safety and efficacy of hormone replacement therapy. I want you to keep this in mind because as you get into the next step, which is talking to your doctor about hormone therapy, please do not be shy to recommend this course to him or her. I think that is not just you who's walking into your doctor to discuss hormone therapy, but many, many other women. And the more knowledgeable your doctor is, not only can he or she help you, but the 100 or not thousands of other women in his or her panel. So you are doing them a favor by talking about Dr. Heather Hirsch's course for providers, how to prescribe and manage HRT with ease and confidence. All right, let's get back to step 4. Step number 4 is crucial. Step number 4 is where you're going to actually explicitly say, I think I'm a great candidate for hormone replacement therapy, and I think that blank would be a good option for me. Now, if you're like, wow, how do I get there? I know. I've got a couple of resources for you. Definitely consider starting with my book, Unlock Your Menopause Type. In this, I talk about the 6 different types of menopause, from premature and early menopause, menopause because of chemo or surgery, full throttle menopause, and even the menopause of the seemingly never ending. If you're in your 50s or 60s or late 60s and you are watching this video and you're thinking it's too late, trust me, it's not. Or check out my video here, how to get started with hormone replacement therapy. These are 2 amazing resources for you besides for all of my courses so that you can say to your doctor, I think I am a good candidate for hormone replacement therapy. Here is why, right? I've been having these symptoms for the last 6 months. It's severely affecting my quality of life. And I think I would like to try fill in the blank. Now, while I can't spend this whole video answering the fill in the blank part, definitely, feel free to check around my YouTube channel. There's so many videos I have on how to start hormone therapy in menopause, how to start hormone therapy in perimenopause, what to look out for after you start your hormone replacement therapy. It's essentially you teaching your clinician all the things that you have been spending countless of hours on social media, on YouTube, researching so that you can really build generational health and thrive this year. So a specific example might say, I'm a really good candidate, I think, for an estrogen patch with nightly progesterone and some vaginal estrogen. Now you might get blank stares from your doctor, and again, which case you might say, you can go into some of the safety of hormone therapy, you can point him or her over to my YouTube channel, you can point him or her over to my courses, but you sticking up for yourself, you saying this, is really getting it into the mind of your clinicians that they must learn or relearn everything they thought they knew about menopause and hormone replacement therapy. Step 5, if you feel like your clinician is giving you blank stares, says something like, I don't believe in hormone therapy. Again, hormone therapy is not Santa Claus. It's not something that you believe in. It is a FDA approved treatment for menopausal symptoms, and it's FDA approved for hot flashes, night sweats, genitourinary syndrome of menopause, of which I do have many videos on, and osteopenia. If your doctor says something like it's going to increase your risk of breast cancer, or some blanket statement that is very fear-based or fear-mongering, you need to say, I deserve a second opinion on this topic because I do think that hormone therapy can be safe for me, significantly improve my symptoms and my long-term health. If you need a second opinion, there's actually many places that you could go. Of course, we would love to see you at the Collaborative. It's my private telemedicine practice. We have clinicians covering almost all 50 states. We have hour-long first visits, and we know everything there is to know about hormone replacement therapy. This is going to be your first and last stop when it comes to menopausal care. There's lots of telemedicine practices, and I definitely recommend that you look at those that prescribe FDA approved hormone replacement therapy, not compounded and not pellets. In fact, I've got many videos on why I don't recommend compounded or pellets. I also have a directory. It's called the heatherhirschdirectory.com, or maybe not the heatherhirschdirectory.com. You can head over there. Those are the clinicians who have taken my course and understand the safety and efficacy of hormone replacement therapy. Never stop giving up on your health. And I do believe that one of the big reasons for you to have this conversation with your doctor is because you are helping the millions and millions and millions of women who are desperately seeking and wanting care. Because I love educating women. It is my favorite thing. Teaching is what really motivates me. But if we can teach one clinician can affect the lives of hundreds, if not thousands of women. So do not stop. I would love to work with you. Again, you could check out my book, check out my YouTube, check out my podcast, or if you're a clinician, you're definitely going to want to get in the healthcare professionals course. All right, I will see you next week for a brand new video. Let me know in the comments what you learned from this one and what else you want to know. All right, have a wonderful rest of the day, and I'll see you next week for a brand new video. Bye, everyone.